Before starting the intraoral examination, it's a must to wear personal protective equipment. Ask the patient to open the mouth and to remove any prosthetic devices so you can better visualize all the structures in the oral cavity. You can use 2 mouth mirrors to retract the cheeks, lips, and other soft tissues. Intraoral examination should be done in a systematic manner to make sure that you don't miss out any lesions or problems. It also provides convenience and can help the clinician save time. First, inspect the upper and then the lower labial sulcus by asking the patient to open the mouth slightly. Then proceed to the buccal mucosa with the mouth wide open. Then to the upper and lower buccal sulcus with mouth half open. Note for any suspected lesions so you can palpate it later. Next, examine the tongue. You can use a gauze to grasp the tip of the tongue so you can see the lateral border, which is usually a common site for cancer to occur. Ask the patient to raise the tongue so you can visualize the ventral surface and also the floor of the mouth. The tissues should appear pink in color with a rough surface texture on the dorsal surface and a smoother surface texture on the ventral surface. The tongue should be symmetrical in shape and in function. Use a bidigital technique to palpate the entire tongue between the finger and thumb of one hand. Tissues of the tongue should feel soft and resilient with no palpable indurations or masses. The clinician should identify the normal anatomy of the tongue, including the papilla and the median sulcus on the dorsum, the foliate papilla on the lateral borders, also the plica fimbriata, lingual veins, and the lingual frenum. Fissuring and scalloping of the tongue should be noted when observed in the patient because it can indicate other conditions. For the percussion test on teeth, lightly tap the occlusal or incisal edge of the tooth using also a blunt instrument. A positive response to percussion indicates not only the presence of inflammation of periodontal ligament, but also the degree of inflammation. In periodontal examination, we first observe the color of the gingiva, which should normally be coral pink and should be smooth in texture. Any enlargement or inflammation of the gingiva should be observed. We use a periodontal probe to assess if there's presence of bleeding on probing and look for areas of gingival recession. It also provides information about the level of periodontal hard and soft tissue support. Next, check the hard and soft palate for any lesions of any kind. This area is slightly less vascular than the oropharynx and is usually reddish-pink in color. The tissue should appear loose, mobile, and symmetrical during function. To test for the mobility of each tooth, which may be related to loss of periodontal attachment or trauma from occlusion. You need a blunt instrument to use. In this case, you can use the end of the two mouth mirrors, putting one on the lingual portion and another one on the buccal portion. Then move the tooth lingually, then buccally, so you can feel if there's excessive movement. Each tooth can vary from class 1 to class 3 mobility. Vitality of a tooth is defined as the presence of blood flow into the tooth. The vitality status of a tooth will affect the success of endodontic treatment and therefore plays an important role in treatment planning. The normal response of healthy pulps are expected to be a short, sharp pain which subsides when the stimulus is removed. But when there's no response, it suggests that the nerve supply to the tooth has been diminished. The electric pulp tester, or EPT, is widely used to differentiate between lesions of endodontic origin and those not seen on radiographs. This device is designed to deliver an electric current to stimulate the closest myelinated A delta fibers. First, dry the tooth that will be tested. Then apply a conducting medium, in this case, a toothpaste. Place the probe tip of the EPT and make sure it contacts the tooth surface. A tingling sensation will be felt by the patient once the increasing voltage reaches the pain threshold. The patient should inform the clinician, commonly by tapping the hand. Using a light curing device, transillumination can reveal problems in your teeth that can't be seen with the naked eye or with X-rays. Decay appears in the image as cloudy shadows, while healthy tooth structure is lighter as light shines through it more easily. This is especially effective in detecting decay under old fillings. It can also reveal fine cracks in the teeth.